if you turn to page 9 in your workbook, categories for blood pressure levels in adults. So optimal blood pressure is a systolic pressure of less than 120 millimeters of mercury and a diastolic pressure of less than 80. In other words, your blood pressure should be 119/79 or less. It is possible to have blood pressure that is too low. Low blood pressure usually results in such symptoms as dizziness or fainting. If your systolic pressure is between 120 and 129 and your diastolic pressure is less than 80, your blood pressure is elevated. You don't have high blood pressure now, but you are likely to develop it in the future. You should take steps to prevent high blood pressure by choosing a healthy lifestyle. Remember, normal blood pressure is less than 120/80. High blood pressure is a reading higher than 120/80. A systolic reading of 130 to 139 and a diastolic reading of 80 to 89 is called stage 1 hypertension. A systolic reading of 140 or above and a diastolic reading of a 90 or above is called stage 2 hypertension. A person with stage 2 hypertension usually needs a stronger dose of blood pressure medicine than a person with stage 1 hypertension or may need more than one medication. There's also a condition called isolated systolic hypertension, or ISH. ISH is diagnosed when the first number, systolic pressure, is high, but the second number, which is your diastolic pressure, is normal. This condition is the most common form of high blood pressure in older adults and is treated the same way as regular high blood pressure. So now that we know the categories of high blood pressure, so what do those numbers mean? All right, so if you turn to the next page in your handout, let's see. So I'm kind of just fill in the blanks as I go. It looks like there are a couple blanks. And I just want to let you guys know, so these numbers are the 5 blood pressure ranges as recognized by the American Heart Association so we have normal, which is blood pressure numbers of less than 120/80. Elevated blood pressure is when readings consistently range from 120 to 129 systolic and less than 80 diastolic. Hypertension stage 2 is when blood pressure consistently ranges from 130 to 139 systolic or 80 to 89 diastolic. At this stage, so usually hypertension stage 1, doctors are likely to prescribe lifestyle changes and may consider adding blood pressure medications based on your risk of cardiovascular disease such as heart attack or stroke. Stage 2 is when your blood pressure consistently ranges at 140/90. At this stage of high blood pressure, doctors are likely to prescribe a combination of blood pressure medications and lifestyle changes. Hypertension crisis. This stage of high blood pressure requires medical attention. If your blood pressure reading suddenly exceeds 180/120, wait 5 minutes and then test your blood pressure again. If your readings are still unusually high, contact your doctor immediately. You could be experiencing a hypertensive crisis. If your blood pressure is higher than 180/120 and you are experiencing signs of possible organ damage, such as chest pain, shortness of breath, back pain, numbness, weakness, change in vision, or difficulty speaking, do not wait. See if your blood pressure comes down on its own. Call 911 immediately. So it is important to know and remember your blood pressure numbers. You should know your numbers as well as you know your shoe size. So be sure to ask what your blood pressure reading is each time someone checks it, and also keep a record of each reading. So I've noticed, like, even when I go to the doctor's office, they typically check your blood pressure and, they either say it's good or bad. So next time I definitely want each of you to ask what your numbers are and kind of just keep a little diary of your blood pressure numbers. So we're going to kind of skip over this next session because this is when we would do a little activity on, I would show you how to use the blood pressure monitor, and then I'd go around the room and show each of you kind of how to use it, and we go through our numbers. So like I said, this part will be on part 2 of this session. We recommend that you check your own blood pressure every day, but you may also want to get your blood pressure checked by a medically trained personnel. You can also have it, so at the Richland County Health Department, we will check your blood pressure for free during clinic hours. If you have any questions on those, or on the hours, or when you can come in, please give us a call at 406-433-2207. How is high blood pressure prevented, treated, and controlled? So high blood pressure increases your chances of developing heart disease or having a heart attack, a stroke, heart failure, or kidney failure. The good news is that high blood pressure can be prevented and controlled. Although you have already been diagnosed with high blood pressure, you can do many things in your daily life to reduce your blood pressure and prevent further problems. Treating high blood pressure can save your life. It can also reduce your chances of having a heart attack, a stroke, heart failure, and kidney failure. So let's talk about some of the most important ways you can keep your blood pressure under control. All right, so one of the ways is this is kind of when I would do a flip chart and I would ask a question, I would jot down everyone's responses on answers, I guess, on a whiteboard. So I would ask, remember the risk factors. Here's a hint, remember the risk factors for high blood pressure. So what you can do in order to, so the question is, how do you lead a healthy life? So you can use less salt, you can aim for a healthy weight, you can eat a low-fat diet that includes fruits and vegetables, you can be active at least 30 minutes most days, you can limit the amount of alcohol you drink, reduce stress, quit smoking, keep your blood sugar under control if you have diabetes or kidney disease, take your prescription medicines as recommended by your doctor, and then check your blood pressure as often as your doctor advises. So those would be all great answers to that question. And then if you turn to page 11 in your workbook and answer, so controlling high blood pressure, 5 ways high blood pressure can be controlled. And if you just want to answer that question. So controlling high blood pressure. Right. So please answer the question on page 11, and then on page 12, you can also review that handout, know your numbers handout. All right. So we're just looking at high blood pressure and weight. So if you turn to page 12, okay, so blood pressure increases your body weight increases as your body weight increases. So losing just 10 pounds can have a great effect on lowering blood pressure. Aim to reduce your weight by 7 to 10% over a period of 6 months. Like I said, we will be going over healthy eating and a physical activity session in this workshop. So if those are 2 things you need help with, we will be going over that as well. And then if you turn to page 12 in your workbook, and it's kind of a session 2 review, this is when I would ask you, this is when I would ask you questions, and then we would jot them down and then kind of review the answer. So if you could please answer those questions, pause this video, and then once you're done answering it, press play and I will go over the answers of the questions. So first question is, what are 3 things that can happen if you do not control your high blood pressure? 3 things. So there are many things that can happen. So you can have heart attack, stroke, kidney damage, eye damage, heart failure, and aneurysms. What are 5 ways you can lower your blood pressure? You can, there are, once again, many ways. You can use less salt, you can be more active, aim for a healthy weight, eat a low-fat diet, eat foods that are high in potassium, calcium, and magnesium. You can manage stress, cut back on alcohol, quit smoking, take prescription medicine, and take prescription medicine advised by the doctor. Is high blood pressure a normal part of aging? No, the risk increases with age, but is not a normal part of aging. High blood pressure is called the silent killer because it usually has no symptoms. Perfect. All right. So the next session, if you choose to skip part 2, I just want to go over that the next session is nutrition. This is when I would ask everyone to bring in food labels from the food that they eat, and we would kind of go over those food labels. So if you just want to, in the next couple of days, just kind of, I don't know, grab a couple food labels that you at home, and we can kind of go over those. You can go over those, I guess, as I'm reading, because I will also have some examples in the workbook as well. Other than that, I think we are good. So like I said, I will see whoever wants to watch part 2. We'll go over how to use your blood pressure monitor, but for now we are done with session 2, and I will see you guys on session 3, nutrition, if you choose to skip part 2. Once again, if you do have any questions or concerns about this workshop, please feel free to reach out to me. My phone number is 406-433-2207 and ask for Ashley, or you can shoot me an email at avandebush@richland.org. All right. Thank you, everyone. Bye.